We're back again with Susie the dog, round 3. Susie's been on parasite medication now for I think about 11 or 12 days. She's been on the Pyrantel. We dosed her on it, and last time we increased her dose of it. I've heard that Susie has been still putting out worms, so that's good, and that she's gotten really itchy, and she's just itching and scratching to the point where she bleeds. So we're going to look at her at her parasite medication and just see how she's testing on that, and then we're going to look at see if we can figure out anything about the itching. And my preference right now, without having tested her first, is to actually take her off the parasite medication, let the parasite worms get back in kind of their life cycle, and then hit them again. We're right now about 19 days away from the full moon. So we're kind of in the middle of the moon here. So she had started the parasite medications right around the last full moon. I'm thinking that what I'd like to do is actually take her off her parasite medications and then start them again in about 12 days or so, which puts us a week before the full moon, and then continue for at least 10 to 14 days. So that would start her a week before the moon and continue her through the moon, and potentially, you know, up to a week afterwards, depending on how she's doing. So that's kind of my preference, is to actually take her off the medications, but let the parasite medication that she's on. But I just want to see how she's testing on it, and I'm testing her again on kind of a variety of parasite medications just to try to see where she's at. And then we'll test some foods out here, and we'll try to see if we can find anything out about her itching. Okay, so let's get started. We've got the baseline with Susie.
Okay.
And let's just start with the Tinda parasite medication for protozoans.
Nope.
No. Albenda, again another protozoan parasite medication. Nope. Diethyl is a worm medication.
Nope.
No. Alinea.
Nope.
No. Mebendazole, worm medication.
Nope.
No. Levamisole, worm medication.
Nope.
Pyrantel.
Yeah, a little stronger, but
not
as strong as before.
Not as strong as before. Okay, interesting. So she's still testing strong, but not as strong as before. Ivermectin.
A little bit also.
A little bit on the ivermectin. Okay. I think last time she was testing well on the Pyrantel, yes. The Mebex, right? If I'm remembering, and I don't remember that she's tested well on the ivermectin before, so that's kind of interesting. Okay, so let's move on to her foods. Let's just do her foods here. This is, I think, the food that she's on. No. The food that she was on previously. No, not really testing strong on any foods right now. A new food.
That's weaker.
That's definitely, yeah, that seems weaker. Okay, and then we've got a pure liver Pure Bites dog treat.
Yeah, same as baseline.
Same as baseline. Okay, so not really testing strong on any of the foods.
The foods are all same as baseline except for the one that was
except
weaker.
for this new food that was weaker. Okay. Well, that gives us a sense of the foods. Now I'm going to move into her drainage. She was on 2 drainage remedies. One was gallbladder ND. I'm suspicious there are maybe some parasites in her gallbladder bothering her gallbladder, and some skin terrain. I don't think she was testing super well on the skin last time, but we wanted to keep her on it because it helped her in the past. So we'll try those. And then she's on DE, a diatomaceous earth. And I also found this Luxolite, which is a toxin absorber for animals. It's basically clay. So I want to test that one out, just because we're talking about itching and skin issues. Baseline again. Gallbladder.
Yeah, that's stronger.
Stronger on the gallbladder. Skin.
A little bit. Not a whole lot.
A whole lot. Okay, DE. Let's look at TE.
Yes.
Yes, really strong on that, huh? That's probably the strongest so far. Is that right?
Yes.
Okay, and the clay. Okay, so the DE so far is the strongest, actually. So that's interesting. She wants to kind of eat dust, be dusted, dust bath, maybe. Okay, let's see if I brought actually some other drainage. I brought a whole box of drainage remedies with me. These aren't everything I have, but this is a bunch of things. And I'm just going to go through some of these and see if we can find something else that's going to help her with her itching. I'm going to sort through here. Vascular, blood, why not? Immune, female is always good. Kidney, brain, you never know. Lymph, you never know there. Gallbladder, this is a different gallbladder one. Skin, we already tested. Neural, colon, just looking for where she might be blocked up. Pancreas, small intestine, bladder, lymph I already had. Adrenal, colon I had. Vascular, I've got some duplicates in here. Lung, maybe something in her lung. Blood, I have that one. Okay, so let's just go through these baseline again and see if any of these stand out. I'm just going to go through them randomly. I'm not even going to call them out.
No.
Nose.
A little bit, maybe.
Maybe pile.
That was very weak.
Gallbladder terrain. Okay. So she's not wanting that gallbladder.
Yeah, that was really strong.
Okay, let's put this in a maybe pile here.
Yes.
Yes. Yeah?
Yeah.
Okay, so let's go through the ones that were maybes. The skin was a no, right? So let's go push this out of the way. We've got the DE, we've got a gallbladder ND, bladder terrain, colon terrain, and female terrain. So let's just go through these. Baseline, gallbladder. No. Bladder.
Yes.
Wow. Yeah, she's really strong in the bladder.
A little bit.
A little bit.
Not too. Same as colon.
Okay, but you think the bladder is the strongest?
Okay,
let's try that again.
Mm-hmm.
Let's try that against the DE. So something in the bladder, something about excreting.
Yeah, that's strong.
Yeah, so the DE to me is it's basically dust. It's diatomaceous earth. It's a very fine powder. It kind of helps flush things when you take it orally. It just kind of, flushes things out. And the bladder, she's testing well on bladder, so that tells me maybe there's some blockage in the bladder. She wasn't testing well on this before. My guess would be, again, I'm just guessing, as we detox things like worms, and as worms die and they break up and they release all kinds of viruses and bacteria into our system, sometimes that can clog up various parts of the detox and excretory pathways. So my guess, again, I'm just kind of guessing here, would be that that's what happened is these worms. That's why I want to check when we're doing parasite medications. I like to keep checking because we tend to get, as things die and move and excrete, our body shifts and things tend to get stuck in different places. So I think then, and she was testing well on still on the same pyrantel parasite medication, but not super strong, right? Let's test that one more time, actually. She's getting antsy, but she'll make it. Let's test that one more time.
Yeah, a little stronger as baseline.
There's baseline. A little stronger, okay. Yeah, so she's still testing well on that. So I would say let's take her off of it. That gives her a little break, a little over, so we're 19 days out. I want to start, so it gives her a 12-day break from parasite medication, and then we'll start her again in 12 days. That'll put her a week before the full moon. Then we'll put her on the parasite medication starting a week before the full moon, through the full moon, up until either 3 to 7 days after the full moon. We'll just kind of see how she's doing and see if worms are still coming out, or kind of see where we're at that time, and probably retest anyway to see what drainage maybe has shifted. Maybe she needs a new detox, something like that. And she's currently on the DE. She's still testing really strong on that, so we'll have to figure out a way to get her to keep taking this, maybe even take a little bit more of it. I'm not going to dose her on it right now. The other thing I would say with her itchy skin is that I would tend to then try to rub the DE in it, maybe even give her a dust bath with the DE. It might be an interesting thing to try, since she's itchy and she's testing really well on the DE. And then the bladder terrain, I would do probably 5 drops. You could do it either orally in her water. You could try that, or do it on her skin, and see if that helps her with her itching. But in the meantime, Susie's done a good job. She's put out a lot of worms in the last 11 days, so we're happy about that. And she actually hasn't had many symptoms other than being itchy. She hasn't really complained about anything else, which is pretty good for being on parasite medications and for putting out so many worms. That's actually better than I would have expected. I would have expected kind of a lethargic puppy, and maybe some upset tummy, or just acting like maybe she has a cold or something like that. But she's been doing actually pretty well, so we're happy about that.